And again, thank each of you for your public service. Dr. Walensky, I wanted to talk to you just for a moment about genomic sequencing. Even before COVID-19 appeared, Colorado made a genomic sequencing of diseases a high priority, and we're now, I think, one of the leading states in detecting changes as they evolve in COVID-19. We test about 15% of all positive COVID tests. I think that's still one of the highest rates in the country. And we also monitor wastewater for community detection. So, Dr. Walensky, how would we, or how can we expand genomics surveillance and expand those capabilities in order to try to stay ahead of existing but also future threats, COVID-19 or otherwise? How do we close the gap between, the states that are heavily sequencing and following this and those that aren't?
Yes, thank you for that and for your leadership in Colorado in genomic sequencing. As I've mentioned, we need to have both numbers and breadth and geographic distribution in order to get a real good view of what's happening in genomic sequencing. So we need to sample from state labs, so we get samples from every single lab. We also get samples from commercial labs, which gives us a lot of volume. We have partnerships now with 19, I believe, academic medical centers in order to do so. And what we do and power our genomic sequencing is so that we are able to detect a sequence that's present at less than 0.1%. So we scale up, and based on the number of cases that we have, we scale up or scale down our genomic sequencing so we can detect it. And what we were able to do with Omicron is when we saw the footprint of the S gene target failure in PCRs, a similar footprint as alpha, we were able to do targeted enhanced surveillance of sequences that actually had that initial footprint and able to identify sequences even before they reached that 0.1% threshold. So as you said, we can scale this up in wastewater. We're able to potentially scale it up for purposes of antimicrobial resistance, for foodborne outbreaks and many other things, which we're really looking forward to doing now that we've established this incredible capacity.
Right, great, that's perfect. Ms. O'Connell, I want to ask you a question in terms of we've talked a lot about the distribution of tests and whether it's schools or workplaces, hospitals. And we've talked about how at this moment we don't have enough tests out there and we're not getting results quickly enough. In terms of the distribution of tests on a national level, we're still obviously working on a system. I know the administration's hard at work on this. But some states like Colorado already have systems in place where tests are being mailed directly to people in their home. And I guess I don't know, is the federal government working with states like Colorado and trying to look at those systems already in place, and how do we integrate the federal system with those states?
Absolutely. Thank you, Senator. That's terrific what Colorado is doing. We have invested $29 billion with the state so they could set up such testing programs however they saw fit. And we are seeing states like Colorado use those funds to be able to do exactly what we're hoping to do on a national level. We are in the process, as we've talked about today, setting this up, working with the U.S. Postal Service. As the federal government, we will allow American households to order and have them delivered to their house as well. I imagine that these will be in addition to what Colorado is able to provide, and we want to have as many tests, of course, available to all Americans as possible. So if Colorado's already doing it, that's terrific. I'm sure we will learn some lessons from the experiences you've had in your state and apply those to this national initiative.
Great. Thank you on that. And then just real quickly, Dr. Fauci, we've heard from Dr. Walensky was just talking about how you integrate the aggregation of large amounts of data. And we've had a discussion about Israel versus South Africa. And it really is a question of how do we take, my question is how do we take information from global sources and learn from those countries who are ahead of us on the curve, make sure that we're learning from their experiences. And I think how can we do a better job working with our international partners to make sure that we are prepared for the next Greek letter?
Yeah, well, thank you very much. Excellent question, and we are just actually doing that. Every week to 10 days, I have a long phone call with Chris Whitty and Patrick Valens, who are the two leading medical and scientific advisors to the Prime Minister of England, to get a feel of what's going on there. We have regular phone calls with our Israeli colleagues, and every Saturday or Sunday morning, depending upon what it is, Dr. Walensky and I and others are on the phone with our South African colleagues. So we are in literally constant communication with them.
Great. Thank you.
Thank
Yield
you.
back.
Senator Marshall.